Welcome to NSG 229, Study Session 7, Oral Rehydration Therapy. Introduction. Have you ever mixed salt and sugar in water? What was it meant for? A portion of salt and sugar in water could make a huge difference between ill health and good health. These three constituents play a great role in body fluid maintenance. In this study session, you will learn about oral rehydration therapy and solution, principles of its administration, oral rehydration solution, the recommended formula of WHO and UNICEF on basic ORT solution. Learning outcomes. At the end of the study, you should be able to 1. Define ORT and explain the principles of its administration. 2. Discuss oral rehydration solution. 3. Describe the recommended formula of WHO and UNICEF on basic ORT solution. Definition of oral rehydration therapy. In 1831, O'Shaughnessy noted the loss of water and salt in cholera patients' stool, prescribed intravenous fluid therapy (IV) for rehydration, and it yielded remarkable results. Intravenous fluid replacement became accepted as the standard of care for moderate and severe rehydration. Between 1980 and 2006, ORT decreased the number of deaths that occurred globally as a result of diarrhea. Oral rehydration therapy (ORT) is defined as increase in administered fluids and continued feeding. ORT is administered with or instead of intravenous IV fluid replacement. Rehydration therapy (ORT) is a medical treatment consisting of liquid solutions delivered orally, designed to counteract dehydration. Principles of ORT administration. Principles of ORT are as follows. Fluid therapy should include the following three elements: dehydration, replacement of ongoing losses, and maintenance. Fluid therapy is based on an assessment of the degree of dehydration present. No dehydration if diarrhea is present, but urinary output is normal. The normal diet and breastfeeding may continue at home with fluid intake dictated by thirst and maintenance oral electrolyte solution Na 45 to 60 mmol/L. Mild. If symptoms and signs are limited to decreased urinary output and increased thirst, mild dehydration is suspected. Rehydration consists of oral rehydration solution or maintenance solution 10 ml/kg/hour with reassessment of 4-hour intervals. Breastfeeding continues. Early refeeding with the child's customary formula at the usual concentration is recommended. Extra oral rehydration solution ORS or maintenance solution e.g. 5 to 10 ml/kg may be given after each stool if diarrhea persists. Moderate. If at least two of the following signs, sucking eyes, loss of skin turgor, or dry buccal mucous membranes are present, moderate dehydration is diagnosed, and dehydration consisting of ORS 15 to 20 ml/kg/hr with direct observation and reassessment of 4-hour intervals. If dehydration is corrected, therapy for ongoing losses and maintenance are continued as outlined above. If not, treatment is repeated as indicated by clinical signs or symptoms. Severe. If in addition to signs of moderate dehydration, there is rapid breathing, lethargy, coma, a rapid tread pulse, or tenting of the skin lasting more than 2 seconds. Severe dehydration and shock are present. Blood pressure should be measured. Prompt intravenous therapy is indicated with rapid infusion of saline, plasma, or colloid sufficient to replete blood volume 10 to 20 ml/kg over 30 minutes may be necessary. Intraosseous infusion should be used if an intravenous line cannot quickly be inserted. General comment. Vomiting is not contraindication to ORT. ORS should be given slowly but steadily to minimize vomiting. Fluids may be administered by nasogastric tube if required. The child's clinical condition should be frequently assessed. A child should never be kept on ORS fluid alone for more than 24 hours. Early feeding should begin within 6 hours. A full diet should be reinstituted within 24 to 48 hours if possible. Oral rehydration solution. For optimal absolution, the composition of the rehydration solution is critical. The amount of fluid absorbed depends on 3 factors: the concentration of sodium, the concentration of glucose, and the osmolarity of the luminal fluid. Maximal water uptake occurs with a sodium concentration from 40 to 90 mmol/L, a glucose concentration from 110 to 140 mmol/L, 92.0 to 2.5 g/100 ml, and an osmolarity of about 290 mosm/L, the osmolarity of body fluids. Increasing the sodium beyond 90 mmol/L may result in hypernatremia. Increasing the glucose concentration beyond 200 mosm/L by increasing the osmolarity of the solution may result in a net loss of water. CHO to Na ratio should not exceed 2:1 in these solutions. Fluid therapy should include the following 3 elements: rehydration, replacement of ongoing losses, and maintenance. Basic ORT solution. A basic ORT solution is composed primarily of salt, sugar, and water. ORT is the giving of fluid by mouth to prevent and/or correct the dehydration that is a result of diarrhea. As soon as diarrhea begins, treatment using home remedies to prevent dehydration must be started. If adults or children have not been given drinks, or if in spite of this dehydration does occur, they must be treated with a special drink made with oral rehydration salts, ORS. Commercially available oral rehydration salts. Mixing commercially available oral rehydration salts with water produces an oral rehydration solution. Packets of oral rehydration salts are available in pharmacies in most countries, although it is. Instructions for preparing the oral rehydration solution and dosage should be followed carefully. Use boiled or treated water to prepare the oral rehydration solution. Ingredients: purified water, amount 1 liter, 1/4 cups. Salt 2.5 ml, half teaspoon. Sugar 30 ml, 6 teaspoons. Oral rehydration solutions should be consumed or discarded within 12 hours if held at room temperature, or 24 hours if kept refrigerated. Fluid therapy. Fluid therapy includes rehydration, replacement of ongoing losses, and maintenance. Fluid therapy is based on the degree of dehydration, which may be mild, moderate, or severe. Contraindications to the use of ORT. ORT is contraindicated in the case of protracted vomiting, despite proper administration of ORT, worsening diarrhea, in excess of fluid intake, onset of stupor or coma, or intestinal blockage. Ileus. ORT might also be contraindicated in people who are in hemodynamic shock due to impaired airway protective reflexes. Short-term vomiting is not a contraindication to receiving oral rehydration therapy. In persons who are vomiting, drinking oral rehydration solution at a slow and continuous pace will help the person avoid vomiting. In some, the contraindication to the use of ORT includes protracted vomiting despite small, frequent feedings, worsening diarrhea, and an inability to keep up with losses. Stupor or coma, intestinal ileums. A basic oral rehydration therapy solution is composed of salt and sugar in water, made using a standard ratio, and is appropriate for use in situations when ORS must be prepared without the standard ingredients. 30 ml sugar, 2.5 ml salt, 1 liter fluid, 6 level teaspoons sugar, 0.5 teaspoon salt, 1 quart fluid, approximately 1 liter. The dehydration project states making the mixture a little too diluted with more than 1 liter of clean water is not harmful. The optimal fluid is plain, clean water. However, fluids such as rice water, coconut water, vegetable broth, yogurt, weak unsweetened tea, unsweetened fresh fruit juice, or even non-potable water are recommended when plain, clean water is unavailable. Water can be boiled or treated with chlorine. However, ORS is not withheld on the basis of potentially unsafe water. Rehydration takes precedence. The molar ratio of sugar to salt should be 1:1, and the solution should not be hyperosmolar. The Mayo Clinic suggests half a teaspoon of salt, 6 level teaspoons of sugar, and 1 liter 34 US FL OZ water. The British Columbia Health Service suggests sugar-free fruit juice mixed with water in a ratio of 1:4, who have, in addition to the benefits of ORS, discussed challenges with availability of, e.g., packets or suitable teaspoons in poor homes and recommended home-made grails, etc. should be considered too. In e.g. 2007, availability of ORS in shops in the main Nairobi slum area was a problem, and use was in decline for various reasons. Likewise, in a Lancet 2013 review, and use was in decline for various reasons. Likewise, in a Lancet 2013 review, due to the stagnant use of ORS, the need was emphasized for more reliable research in rehydration with appropriate homemade fluids. See also the introduction. Administration of oral rehydration therapy. WHO and UNICEF guidelines suggest ORT should begin as the first sign of diarrhea in order to prevent dehydration. Babies are given ORT fluid from a dropper or a syringe. Infants under 2 are given a teaspoon of ORT fluid every 1 to 2 minutes. Older children and adults take sips from a cup. If the patient vomits, the caregiver waits a short time, then persist with the ORT. A key element of ORT is that water is still absorbed from the gastrointestinal tract into the body, even with loss of fluid through diarrhea or vomiting. In the case of vomiting, a key element of ORT is that water is still absorbed from the gastrointestinal tract into the body, even with loss of fluid through diarrhea or vomiting. In the case of diarrhea, WHO recommends giving children under 2 1/4 to a half cup of fluid following each loose bowel movement, and older children a half to a full cup. ORT is often given by parents or other family members in a home setting. ORT is also given by aid workers and healthcare workers in refugee camps, health clinics, and hospital settings. Mothers should remain with their children if at all possible. WHO recommends continuing breastfeeding and perhaps even relactating if circumstances realistically is allowed. Summary: oral rehydration therapy (ORT) is a medical treatment consisting of liquid solutions delivered orally designed to counteract dehydration. The degree of dehydration for fluid therapy may be mild, moderate, and severe. Fluid therapy should include the following 3 elements: dehydration, replacement of ongoing losses, and maintenance. For optimal absolution, the composition of the rehydration solution is critical.